perfect.
Knock, knock. Hi, my name is Vanessa. I'm going to be your nurse today. Let me go ahead and wash my hands. Close the curtain for privacy. Can you give me your name and date of birth, please?
James Koenig, 10/31/93.
Okay, and that matches your wristband. And what brings you in today?
I'm just here for a general assessment.
Okay, and do you know where we're at right now?
The hospital.
Do you know who the president is?
Biden.
And what month are we in?
February.
Alright, just by that I can tell that my patient is alert and oriented ×4. His speech is clear. He is well groomed. Skin color is even and appropriate for his ethnicity. Posture is upright. So I'm going to go ahead and start my assessment now, starting with your head. I am checking for any bumps, lesions, or parasites, checking that the hair is evenly distributed and it looks good. Head shape is normal cephalic. Go ahead and close your eyes and let me know where I am touching you.
Alright, left cheek, right cheek, forehead, chin.
Alright, cranial nerves number 5 and 7 are intact. I'm gonna go ahead and move on to your eyes. Just by looking at your pupils, I can see they are equal and round. I'm gonna shine a light into your eyes now. Pupils are reactive to light, so follow my pen to your nose. And eyes are accommodating, so go ahead and follow my pen. Cranial nerves 3, 4, and 6 are intact. So go ahead and cover one eye for me and let me know when you see my fingers.
See him?
Okay, and the other one?
See him.
Okay, cranial nerve number 2 is intact. I'm gonna go ahead and move on to your ears. I'm checking for any redness, any discharge, or cerumen. And they look good. So go ahead and close your eyes and let me know when and where you hear noise.
Left ear, right.
Okay, cranial nerve number 8 is intact. I'm going to go onto your nose. I'm gonna have you tilt your head up. And I am checking for any redness, any discharge, any signs of a deviated septum, and everything looks good. So I'm going to have you cover one nostril and breathe in. And now cover the other nostril and breathe in. Cranial nerve number 1 is intact. I'm going to go ahead and move on to your mouth. So open up and say ah. I'm checking mucous membrane looks pink and moist. Teeth are intact. Uvula falls midline. Go ahead and lift your tongue. Move side to side. All right, cranial nerves 9, 10, and 12 are intact. Go ahead and swallow. Any pain while swallowing?
No.
Okay, I'm gonna go ahead and actually check your carotid pulses, each one at a time. Okay, carotid pulses are +2 bilaterally. I'm going to check for any bruise now with the bell of my stethoscope. Okay, no bruise noted. I'm gonna go ahead and check your lymph nodes now. Let me know, I'm gonna palpate your lymph nodes. Let me know if you feel any pain or tenderness. Starting with the preauricular, postauricular, submandibular, submental, anterior cervical, posterior cervical, occipital, and supraclavicular. Any pain or tenderness?
No.
Okay, so I'm going to have you go ahead and shrug your shoulders and then look side to side. All right, cranial nerve number 11 is intact. Trachea is midline. I'm going to go ahead now and move on to your lungs. I'm going to take a listen to your lungs, front and back. So every time I place my stethoscope, please take a deep breath in and out. Moving on to your back. Okay, lung sounds sound clear bilaterally. Unlabored breathing, no accessory muscles are being used. I'm going to go ahead now and have you turn. I'm going to check your spine. Spine is midline. I'm going to go ahead and percuss your costovertebral. So let me know if you feel any pain.
No.
Any pain?
No.
All right, I'm going to check for thoracic expansion. Every time I touch your back, just take a deep breath in. Okay, no abnormalities there. I'm gonna go ahead and check tactile fremitus. So every time I place my hands, please say 99, 99.
99, 99, 99, 99.
Okay, vocals are symmetrical. Gonna go ahead and listen to your heart now. So you can breathe normally for this. Starting with the right aortic, second ventricle, intercostal. Moving on to your left, second intercostal, pulmonic. Then your third, left intercostal, Erb's point. And then your fourth, left intercostal, tricuspid. And then your left mitral, midclavicular. All right, so no extra heart sounds or murmurs noted there. I'm going to go ahead and have you lay down. I'm gonna check your abdomen. So looking at his abdomen, I see it is flat, no scars or lesions noted. So I'm gonna go ahead and listen to your bowel sounds now. Starting with the right lower quadrant. Okay. Bowel sounds are present in all four quadrants. I'm going to palpate now, all four quadrants, so let me know if you feel any pain while I'm doing this, okay? Okay, any pain or tenderness there?
No.
Okay, and when was your last bowel movement?
A couple hours ago.
Okay, and when was the last time you urinated?
So a couple hours ago.
Did you have any difficulty or pain while doing both?
No.
Okay, so I'm gonna have you scoot up a little. I'm gonna check your pulses now. Okay, so starting with your radial pulse. And moving on to your brachial. Your popliteal. Post-tibial. And dorsalis pedis. Okay, so all pulses are +2 bilaterally. I'm going to check your extremities now. Check for any edema, or do you feel any tenderness?
Nope.
And check your legs, no edema. Normal temperature, no tenderness or deformities noted. I'm going to check your IV site. Make sure that it is dry and intact. Check your capillary refill. Less than 3 seconds. Check your toes. Less than 3 seconds as well. I'm going here, I would check for your reflexes to make sure they're all active. I am going to check your strength. So go ahead and squeeze my fingers. Okay. And then push down. And then pull up. Okay. And then go ahead and put your arms up. Don't let me push you. And then don't let me. Okay. I'm going to, let's do your legs too. Okay, strength is good. We're going to do range of motion now, so just copy everything I do. So we're going to do your arms straight out and go forward and then backwards, and then let's do your neck. Let's go this way and then around, and then your legs. I'm going to have you stand for this. Go ahead and lift your legs. Okay, do you feel any pain?
No.
Okay, so I'm going to have you take 2 steps. 2 steps towards me, and then 2 steps back. Okay, turn back towards me. So now gait is good. I'm going to have you go ahead and close your eyes and open them. And the Rongberg test was negative. So go ahead and have a seat now. I am done with my assessment. Are you comfortable?
Yeah.
Do you need anything?
No.
All right, your call light is right next to the table. So just let me know if you need anything. I'm going to close the curtain and wash my hands.